Hi, this is Paul Slatkus, Good News Planet. I'm speaking to Dr. John Dodes. Hi, doctor. How are you?
Good morning, Paul.
You know a little bit about this dentistry stuff, right? Taking care of the teeth. Are you supposed to, like, every morning floss or every night?
You're supposed to floss once a day. I don't think it makes a huge amount of difference when, but I think it's probably better to floss before you go to bed at night because you've accumulated food stuck between your teeth during the day, and I think you really want to sleep with as clean a mouth as humanly possible.
Aha, okay. You were a dental flight surgeon in the Air Force. Thank you for doing that kind of work. And we're going to talk today about, taking care of your teeth. And October is the National Dental Hygiene Month, and you're an advisor to the Council on Science and Health. And so, what is take care of your smile? So, if you take care of your teeth, you think you have a nicer smile?
Oh, absolutely. There's nothing that looks worse than having bleeding gums when you try to smile. Or missing teeth. So, yes, you want to take care of your teeth, and people should realize that dental disease is the most common ailment of mankind, and yet it's almost all preventable if you brush, floss, and rinse every day.
Let me ask a question. I had a cap one time put on my tooth, okay, and that tooth bleeds a little bit. And is that bad? And I mean, if I use sort of a water pick type of thing or whatever, and it goes away. What should I be? Is bleeding gums a common kind of thing for some people?
Bleeding gums is very common, and it's one of the signs that someone has a gum problem, because bleeding gums means that there's been enough inflammation in the gum to cause the blood vessels to become very weak and to break easily. Gums shouldn't bleed. So if your gums are bleeding, it's because something's going wrong, and you should have it checked out by a dentist.
Aha, okay. When I checked it out, he told me once again to use the water pick more often. He said if you continue to use that, then it does go away if I use it like every day. Is that...
That's true. What happens is food collects that you don't clean out. Bacteria eat the food, and they produce toxins that damage the gums. If you stop flossing, brushing, water picking, rinsing, because it's bleeding, it's only going to get worse. You got to get in there and get that food out, get those bacterial factories broken up so they can't produce those toxins, and then your body will heal.
So there potentially is a healing that this won't. I mean, it does come and go. It's not like a thing, and it seems to me also like when I'm more under stress that it happens as well. Could that make any sense?
Well, certainly stress affects your skin, and gums are related to the skin, but it's certainly something that should be checked out. Your dentist should be not only taking an x-ray there, but should be taking a periodontal probe and seeing if there's a pocket there. If there's a pocket, then there's a place where food is collecting, and that pocket has to be treated.
Aha. And
a periodontal probe is it looks like a little stick that has colors on it, and the dentist sticks it between the tooth and the gum to see how deep it goes.
Okay. All right. Well, this is good. Okay, don't skip your dental checkups, right? So what should people be doing on a annual basis, on a biannual basis? What do you suggest, Doc?
Well, you really have to model it to the patient, but as a general rule, people should have an exam with some x-rays once a year, a full set of x-rays every 5 to 7 years, and a cleaning twice a year. Now, there's some people who can go a full year without having a cleaning. They can have one cleaning per year. And there's other people who need to have their teeth cleaned every other month. But as a general rule, twice a year is the way to go.
How do you know whether you have a good dentist or not?
Well, it's not that hard. You don't need to have dentistry done constantly. You're not losing your teeth. Your mouth feels comfortable. Your gums don't bleed. Your teeth aren't loose. Your mouth doesn't smell. For every year you've gone to a dentist, you've lost a tooth. Maybe that's not the best dentist to be going to.
Well, that's an interesting kind of a thought, by far. How about like you do all the right things. You floss, you do the water, and you do that nighttime and you do those things in the morning. Now you're going to go out and talk to people. What do you suggest people do before that? Eat a mint, or do the routine again? Brush again, take some Listerine, and take a swish of that. That's what I do. I take a shot of Listerine.
Well, I teamed up with Listerine just so that I could bring this message to the public about how to keep your dental health. And obviously, rinsing with something like Listerine is great. I do it. I advise my patients to do it. I think it's a great thing. The Listerine gets into areas that a toothbrush and floss won't get to. I recommend that people do it twice a day, in the morning and at night. And if they like something that's gentler, Listerine just came out with a Listerine Zero, which has no alcohol and has a milder taste to it. I've just been trying it the last week, and I really like it.
Interesting. I put some of that when I do the water pick. I put some of the Listerine in there when I do the water pick. Is that a good idea?
I think it's a great idea.
All right, good.
Yeah, I think that, anytime you can get those essential oils in your mouth is advantageous.
Essential oils. Why you say
that?
Yeah,
that's Listerine has these 4 essential oils, and they really are the things that are very effective. It's the only mouthwash that's been approved by the American Dental Association.
Really?
The only over-the-counter mouthwash. Yeah, it's good stuff. It's been around a long time, and there's been a lot of research on it, and it really has some good science behind it.
And the formula, like, their Cool Burst and all their different fresh mint, I mean, I'm into it. So it's still the same formula, just with a different flavor?
Exactly. I personally like Total Care because it has fluoride in it.
Yeah.
And I like the extra shot of fluoride. I've had enough cavities in my lifetime. I don't want to get any more.
And you're a believer that fluoride can keep people from getting cavities?
Oh, it's not a question. It's like saying, are you a believer that the earth is round or flat? All the science is there's so much science, you'd have to be perverse not to believe that fluoride stops tooth decay.
Interesting. All right. Very good. And they have one, I did a story on one of those Listerines where it shows you where you didn't brush. I know there was in fact, I suggested that people should use it as part of their Halloween costume.
That's for a lot of the kids. It's
right.
Smart rinse, and it's a good thing that kids learn how to brush where they're missing with the toothbrush. It's a good adjunct to teaching children how to brush.
I think it's probably good for adults to, all those things that are good for kids are good for adults to try later on in their life to see, because we become people of habit, right? Creatures of habit.
We'd probably be terrified and see what a lousy job we're doing.
This is what I'm saying. I think we're going to do some shows about that. It's always one of those realities that as you get older, it's just you do it the same way. But it's an interesting thought. Now, here's a interesting last thing here. Enjoy a good night kiss. Well, I like that comment here that I see written down here. What does that mean?
Well, I'm happily married for over 35 years, and I think one of the nicest parts of the day is when you kiss your loved one good night. And it's not a very pleasant thing if you have bad breath. So I think it's real important that people keep their mouths healthy, because that's the way you avoid having bad breath. Of course, bad breath can be caused by a lot of other things as well. So if you have bad breath, you have to be checked out by a dentist. Make sure that you don't have cavities or gum disease or some systemic disease, because, things like diabetes, people who are uncontrolled diabetics have a certain odor to their breath, which is detectable and actually can be one of the symptoms of diabetes. So if you're checked out and everything's fine except the way you're cleaning, you certainly would want to clean better, and you would want to brush, floss, and rinse with something like Listerine before you get into bed at night.
Okay, Doctor, last question. What's good news for you?
Good news for me would be that there's a real decrease in the amount of dental disease because people are brushing, flossing, and rinsing properly.
Okay. A pleasure speaking with you. I've learned some new information, and we're going to share it with the whole world. Thank you, sir.
Thank you.